Thank you. And any other questions for Lakeisha Aline? All right. Thank you very much.
I'm sorry, Commissioner
One more
Bailey
question.
has a question.
Commissioner Bailey.
So this is actually a question for you, David.
Yes, please.
And we've heard wonderful testimony here from these peers. We heard from throughout the presentation today the importance of peers in the process. So I guess one of the questions that I have for you, and it's sort of a multi-part question, we can talk about it now, and then if there's more information given the time constraints, you can follow up with me or anybody else who's interested. But I'm curious, given the expansion that we've had from the Affordable Care Act, the number of folks that we've served, and the ability we have to serve more people, how have we then also integrated and expanded our work with peers to make sure that we have a system that's working for everybody? How do we plan to do that going forward in the next fiscal year beyond sort of the 3 formal advisory councils that we have? And then we also heard about paid support services from peers. Do we have a plan for that in the budget as we go forward?
Sure. Let me see if I can touch on all those, Commissioner Bailey. So in terms of the history here in Multnomah County, Ann also alluded to, the county has for approximately the past 8 years had a contract with NAMI to train peers in peer-based support, several different programs. Once the state had come forward with a certification process, we also put an RFP out to ensure that the peer-based programs that the county contracts with for education, support, and training met that certification requirement, so people could subsequently be certified and go out and be employed in the community. We also have peer-based programs that the board has continued to support. North Star, in terms of employment, is another peer-based service program where individuals can go ahead and get the support and help they need to move forward in employment, and as Ann mentioned, have productive and goal-oriented activities every day in their lives as well. Part of what we do, and as the Mental Health and Addiction Services Division, is we don't tend to provide all the services. We are more administrative than a service provider. What we do tend to do is we contract out a majority of our services. So we rely heavily on the network of contractors that we have in the community, for contractors for individuals that serve people who have a more chronic condition, people with serious mental illness. All of those contractors have peers on staff. Various agencies are in different points in their development of integrating peers into the service system, and we'd be happy to provide more information as well to ensure that the board is aware how peers are being used in the treatment system as well as supports for individuals. I think also Dr. Ferentinos also mentioned the goal to have peers assisting with navigation through the system to provide support. You've heard also that in the crisis services system, we've added peers in that part of the system as well. So globally, we are looking at adding peers in all components of the system. Additionally, internally at the county, in our jail diversion programs, we have peers also. In our early psychosis program, we've also employed peers in that program. So we are certainly pushing forward. There is, I can certainly say there is a need for more peer voice, more peer engagement in our community. We'll continue to use our advisory committees for that support as well. They are a great avenue for us to come together with the community and for them to help us reach out further. So those would be the things I would say initially right now. As we look to FY17, we will continue to bring forward the opportunity to go ahead and continue funding the peer support programs and hope to grow that over time.
Thank you.
Yes, absolutely.
Madam Chair, if I could.
Thank you very much.
I really